Hello, all you beautiful ones. This is Sharon D coming at you with the information I promised. Yes, I've gotten a lot of questions about what I mean by special needs products. I guess when I was doing the eye treatment video, I mentioned that you put your moisturizer on after you put on your eye treatment and other special needs treatments. So people have sent me little questions about what is this? What do you mean special needs? What are my special needs? Well, special needs are different for everyone. And then some special needs are pretty consistent with age and environment and so forth. So let's do some housekeeping real quick. I want to make sure you guys, if you pop on, let me know you're here. Oftentimes I'll get off and have no idea you were here. So let me know, drop me a little emoji or a little hi, or just click the button. It'll show your name and I'll know you're here. Isn't that wonderful? All week, the drawing will consist of your letting me know that you went off to my YouTube channel and you subscribed, you liked, comment, and shared, and you let me know that you did so. And that will put you in the drawing for the week. That is the whole week, what we're doing. And also, if you show up on videos, you will also get in there. So, okay. So the question being, what do I mean? Special needs. What do you mean, Sharon? You're always saying these things and you don't tell us what that means. Special needs. What are special need products? Well, as I'm always telling you, you know consistently that your skin needs to be cleansed, toned, and moisturized. We all need that. Everybody. But depending on the type skin you have, the age of your skin, and again, I've said this before, your skin age is not always consistent with your chronological age. Skin age can be very different. You can have 50-year-old skin and have 30-year-old skin age because you've done a fabulous job of taking care of it. Or you can have 20-year-old skin chronologically and have 30-year-old skin issues because of a multitude of things. Sometimes heredity, sometimes what we're eating, sometimes lack of care for our skin, sometimes the environment, and sometimes health reasons as well. So there's a number of reasons that your skin age could be drastically different than your actual age. In addition to that, you may have certain things that have brought on issues. Sometimes that can be medical, it can be hereditary, it can be hormonal, it can be all kinds of things. Oh, stress. Stress is a big one. Oh man, is stress a big one. So what starts happening is, well, let's start at the beginning when you're going through the teenage years. You acne, breakouts, lots of oil, big pores, those kinds of things. So that would be a specific special need, is to deal with treatments for acne, for scarring, for the breakouts themselves, and to just keep the skin under control so that you won't have a multitude of breakouts. We recently added this line called Remedies. And the Remedy line is specifically to do just that, remedy. In the Remedy line, it has a Scar Balm, the Royal Jelly Scar Balm. And it also has I'm trying to stay in the camera and still be able to read this. It also has extra soothing balm, and that extra soothing balm is where you need intensive treatment for like extra dry skin. Okay, remedies, and that's very easy to remember because it is the remedy for those particular issues. We have a line that is called the Pro line, and the Pro line has specific things for specific issues. Let me bring up some of the other issues that we would have. I'm going to take that down and I'm going to show you. So probably the very first thing in addition to acne that you're going to want to do is eye treatment, because that is the first place generally you're going to start seeing those telltale signs that you're getting older. This part of our skin in the occipital lobe is the thinnest skin on our entire body. Thereby, it's going to tell off on us. Plus, think about what we do. We're always moving, blinking, twitching. Our eyes are frequently moving. So you're going to have some lines and some little things that'll let you know that it needs some help. I also mentioned in that video about your eye cream that you can do double duty with your eye cream by using it around your mouth. That's the other place on your face that's constantly moving. Yes, constantly using that mouth. So it's not going to show age as fast as around the eyes, but it will catch up with you. So use that if you're wanting to hold that off. The other thing would be you would have appearance issues and texture issues. Okay, so the appearance issues can be like discoloration, it can be scars, it can be dry patches and so forth, and also the starting to sag and droop and so forth. So we have products that can take care of that. Generally, there are certain things that are going to revitalize your skin. It's going to act as an anti-aging, and those are the products that you want to start using once you are pretty much, I'd say 30s. I wouldn't want to wait much longer than 40s, because you really, by then you've got significant amount of damage that you're going to have to try to stop, but reversal is a little more difficult. So appearances can start to change, and then there's things that we do that will affect our appearance and texture of our skin. Alcohol, sorry. Smoking, sorry. Sugar, fried foods, sodium, gluten. All of those things show on our face. Yes, indeedy, and more. Along with that, when I say appearance of the skin, sun damage. So if you're not using a sunscreen, SPF 50, minimum SPF 30, minimum. If you're not using a sunscreen, you're going to incur the wrath of the sun on your face, truly. Now, and again, I've been saying this, and there's in my videos, you'll see I did this whole thing on why we need to use sunscreen, even if we have darker complexions. Some of the things you probably never even thought of, that health issues are impacted by having too much sun. Medications can be, the effects of the medications, the intended effect of the medication can be nullified or intensified by sun exposure. Check out that video. Actually, I will put that video specifically on my YouTube channel. Again, if you have not checked out the channel, please, it's my baby right now. Check out the channel. I'll put the link up here for you so you can just go and like, share, comment, big thumbs up, and subscribe, subscribe, subscribe. Yes, just starting out on the YouTube track, and they have certain rules. You have to have so many subscribers to open up and unlock certain things. I guess it's sort of like a video game, right? And so I do need your help on that. Plus, you'll be able to get lots of good information. I am trying to have them segmented so that it's skincare. I have a skincare playlist. I have a makeup playlist, and then I have a playlist that will be specifically just for overall care, self-care. So back to our main objective here is to look at what that means, special needs. So we're at the point of improving texture and appearance. Texture can also be affected by, scarring and inflammation, acne in the past that didn't heal well, or so forth. And those things can be taken care of with special needs products. And I'm happy to do a skin assessment for you and give you recommendations on what products you need, what specifically is something that would benefit your skin. Okay, I'm going to take that one off, and I'm going to show you the next one, which is vitamins and antioxidants. Yes, we know, and you guys that have hung out with me for a while, you know that I've always told you there are three main vitamins that we know that are regenerative. It's gonna get worse as I say it again, right? Regenerating vitamins and minerals for your skin. A helps with texture. It helps shrink large pores, and it helps with any acne issues that you're having, okay, that have left its mark on your face. C takes care of discoloration, gives you an even tone so that the damage specifically usually from the sun, because that's a really good point I want to make here, is that when I talked about the sun, I want to make sure that those of us who have darker skin, that we realize and recognize that, we may not have as prevalent of issue of skin cancer, but guess what? The skin shows its effect on our skin earlier and quicker. And that effect appears in the evidence of dark skin hyperpigmentation and blemishes, changes in the tone of our skin and the texture. And believe me, that shows up faster the darker your skin is. Yes. Yes. So please don't dismiss the need for skincare. Please don't do that. Say, we're on vitamin C. I got stuck there because we're talking about the discolorations. But then we have vitamin E, which is an extra hydration. It gives an intensive amount of moisturizing, and it also does help with the lightening process of textures that are discolorations and textures that are like a hyper growth. You know how it can get an area that you have can get like the skin gets a little thicker there. That's what that is. So you want to use vitamin E, products that contain a higher level of vitamin E. And just in and of itself, the the big daddy of them all, and I didn't add it, and I'm going to put it up here now because it truly is the big daddy of them all when it comes to this Royal Jelly. Royal Jelly is a product made by bees. It's made by the worker bees. It's fed to the queen bee. In fact, that is believed to be what makes the queen bee the queen bee. She eats a diet of royal jelly consistently her entire life, and that diet allows her to live 70 times longer than the worker bees and grow 70 times larger than the worker bees. She's getting them. There's evidence of use of royal jelly all the way back to the Egyptians. They say that Queen Cleopatra used royal jelly milk, to keep her young and gorgeous complexion and skin. So that is why I'm in skincare. Absolutely why I'm in skincare. Because, let me take that down. That's why I'm in skincare, because I found that royal jelly helps to keep down inflammation in your skin. It improves the texture, it improves the tone, it repairs, it corrects. It's just an all-around, can't do without kind of product. I am very sensitive to products. I can't use a whole lot of different things. So when I found that I could use this product, Royal Jelly, I of course had to stick with it. And it's done right by me all these years. And I'm encourage people, especially people that have issues with inflammation on their skin, that is a very excellent product to get into and to try out. And I'm happy to send you some samples so that you can do that. But again, the main issues that you're going to be concerned about when it comes to special needs is eye treatment, products that are going to tone and firm the skin, products that are going to help with the change in texture and the appearance of changing in texture on your skin, and hyperpigmentation, rosacea, discoloration of your skin for whatever reasons. We talked about a few things that can cause that. So again, I'd be happy to do a skincare assessment for you online, on the phone, in person. If not me, someone on my team. We've got people all over the United States that can help you with this, and you will totally love being able to know what it is your skin is trying to tell you and what your skin is needing. Because your skin tells you, it tells you what it needs. You just have to listen and obey. So that is it. As I said, in the Pro line has products that are for special needs specifically. Wrinkle reducing and firming night recovery concentrate, which is a firming agent. Face lift, which also has a SPF 20 in it. Then you also have even tone, and the purpose of even tone is just what it says, to even out your tone. Also, where is it? The Dermaline filler. Yeah, These lines start wanting to share their existence. Those lines that want to tell everybody, what's not. So, but there are many products that we can recommend, or even just doing the skin assessment gives you the understanding of what it is your skin is needing. So you can choose to go through whatever products you want, but it gives you a baseline to know what it is that you need and what your skin is trying to tell you. So thank you. I value you. I value your time. I appreciate your being here. I will put the link to my YouTube channel. Please jump up there and like, comment, share, and give me some thumbs up if you like the information. And subscribe and share with your friends to subscribe. You have a great day. This is Sharon D signing off. Bye bye.